Hi, welcome to today's video. We are talking about knee arthritis and treatment options. Now, what I found is a lot of people will follow this path that they get their knee pain and the diagnosis of arthritis. They take the medication and then they think that surgery is inevitable. And that's why I've created this video just to go through these steps that I think are crucial and tend to be missing with a lot of people. Now, the first step is to understand your pain triggers. Please download our free guide. The QR codes on the slides and the links in the description below. So for those of you that don't know me, my name is Claire. I'm a physio. I've seen many people over the years who come in, they tell me that they've got knee arthritis, and then the next thing they say typically is that they've got X number of years before surgery, so 3 or 5 years before surgery, and that's just what the surgeon or somebody's told them. So I'm here to just let you know it's not inevitable, and I just want to give you the information so you can make your informed choices. There's a lot more options available to you than just going down the surgery route. So let's start at the beginning, which is understanding your pain triggers. Yeah, that's why I've got that guide for you to download. If you think about the car, the light in the car comes on, and you know, what do you do when it comes on? Do you bury your head in the sand, think it will go away? Or do you put tape over the light, or do you just replace the engine because you know something's faulty and you need to do something? Hopefully what you do is actually go to a mechanic just to figure out what's going on with the car. And that's what you need to do with your knee pain. Yes, you might have been diagnosed with the arthritis, but you just need to figure out what's contributing to the pain. And it's not just what's going on in the joint itself. There is a whole load of other things that might be going on. And understanding that will just give you the different options to then figure out what future management tools you've got. So that's your first step, understand your pain triggers. So then you obviously want to reduce your pain. It takes you into the next step, which is that conservative management. Exercise features strongly in this. Interestingly, a study has suggested 50% of those diagnosed with arthritis have never tried exercise. So it's free. It does need to be tailored to you, but it's really good at managing your pain. Your other option for conservative management is understanding your pain. Another study has looked at understanding pain, compared it to exercise, and found it's as effective as exercise therapy. So downloading that free guide to help you understand what's triggering your knee pain, looking at these videos that we've got, it will all help in that management. I do need to mention here with the conservative management option, please look at your sleep and look at any stress and reducing any stress and going into any relaxation that you can do. Pain is a whole body experience, not just in the joint itself. So you do need to look at all of these things that will help manage your pain. The other option for managing your pain is medication. This is slightly controversial because a lot of people don't want to take painkillers at all. I do think that they're a useful tool as long as you have understood what's causing your pain triggers, and then you can start taking painkillers rather than just taking them blindly, thinking that they'll help. Yes, painkillers are useful temporarily, perhaps if you're kind of reluctant to take them. You know, take them for a couple of days just to get yourself over a little bit of a bump. But yeah, useful tool. I do need to say here, please get advice from your GP about what painkillers to take. There are many out there, and yeah, just it's an individual thing that your GP is best placed to discuss with you. The last option in that treatment pathway is surgery, and so yeah, you just want to get like the best outcome from surgery. Now, some of the studies suggest 70% of people are really happy with surgery, which is great. However, that does suggest 30% aren't too happy. And so you just want to put yourself in that 70% category and make sure you can get the best out of any surgery you do need to go down. So your treatment pathway is you get your knee pain and your diagnosis of arthritis. Please go into understanding that pain. It will really help you. That's your first step. You've got your conservative management options: exercise, sleep, relaxation. There are multiple others. It just depends on you and your situation as to which one is going to be the most effective for you. Consider medications. You don't have to, but they are a useful tool. Please chat with your GP. And then I put the surgery in brackets because it's not inevitable. There's a significant amount of people that go through all of this understanding, exercise management, and find they don't actually need surgery at the end of the day because they're managing their pain. If you do all of this, the understanding, the conservative management, and find you still need surgery, you will know you have done the best you can to get the best outcome after surgery. So it's all a win-win. Your action steps from here are to download and explore your pain triggers. That's your first step. Book an appointment with us. We do online consultations, or with your healthcare professional, but please make sure that they are holistic in their approach and don't just focus on the knee or just focus just on the knee. You can join us for our workshop. The link is in the description below. It just takes you from that understanding and gets you into doing some action steps from it. Please share this video with one person you know with knee arthritis that would really benefit from knowing what we've been discussing. Please put any comments you've got down below. I'm really interested to hear from you. Thank you very much for watching, and I'll see you soon.